Postpartum depression usually occurs in first-time mothers, but it is important to note that it can happen to any mother. Postpartum depression is a mix of physical, emotional, and behavioral changes that happen after giving birth.
If the depression goes on, it could cause her to have thoughts of harming herself or the baby as well. So this is like a severe form. If this is not treated, it goes on to become postpartum psychosis. This is the form where the mom might now decide to take actions on the thoughts that she would have had.
According to Dr. Singh, the mother can start to see things, hear voices, and may attempt to harm herself or her baby.
It's very, very important to understand that postpartum depression is actually one of the most common complications of childbirth, and it accounts for over approximately 15% of pregnant women.
Other factors that can contribute to postpartum depression are women who would have been diagnosed with depression before getting pregnant, and unplanned pregnancy, complications, and little or no support after delivering a baby can also lead to depression.
So there is a screening tool called the Edinburgh Screening Tool, and it's a tool that consists of 10 questions. So basically, you can ask patients in the postpartum period these 10 questions, and then based on the scoring that they're given, you can tell what index of suspicion you have for depression in them. At the postpartum clinic here at GPHC, the moms are usually encouraged to come back for a 6-week visit, and at that time we do speak to them about these kind of things. The nurses also in the ward, they do speak about what to expect with having a new baby and how to deal with these kinds of things.
Here is what family or friends can look for in a mother who recently delivered her baby.
Depression starts almost immediately as baby is born, or as soon as probably 1 week into delivering the baby. So the family should be alert and look out for these signs that I mentioned: crying, the inability to sleep, the unable to care for baby, feeling that she's not bonding with the baby, having thoughts of harming herself or the baby, having thoughts of worthlessness, these kinds of things. So if the family would have noticed that, the first thing that they should do is not tell her to snap out of it, because it's not her fault. It's not something that can just go away. It's not a form of weakness or a sign of weakness. It's actually something that happens. So the family needs to give her support, show her that they are there, assist her with whatever she needs. If she's unable to take care of baby, help her to do that. Those are the initial steps that they should take. But aside from that, they should also encourage her or bring her to the hospital to seek medical advice.
Reporting for the newsroom, I am Isanella Patwo.